Welcome to the Health Horizon channel, where we bring you crucial health knowledge you can't afford to miss. Today, we're diving into a topic of utmost importance, one that can happen anytime and pose a serious threat to life: sepsis. You may have heard of it before, but do you really understand the early warning signs of this life-threatening condition? Imagine one day, you or a loved one suddenly feel unusually fatigued. Your skin changes color, you start breathing rapidly, or even lose focus and become disoriented. These could be the first signs of sepsis, and if not recognized and treated promptly, it can lead to organ failure and even death. Don't let these symptoms pass you by without noticing. In today's video, we'll show you how to recognize 10 early warning signs of sepsis so that you can act immediately and save your life or the life of a loved one. Be sure to watch this video until the end, as the knowledge shared here could be the key to saving a life in an instant. Changes in mental status. Symptoms like confusion, disorientation, or agitation may signal an infection affecting brain function. One of the earliest and most alarming signs of sepsis is a change in mental status. This can manifest in a variety of ways, including confusion, disorientation, or agitation. The brain, which is responsible for cognition, memory, and awareness, is deeply affected by the inflammatory response that sepsis triggers. When the body fights an infection, the immune system releases a storm of chemicals, such as cytokines, into the bloodstream. These chemicals are essential for immune defense, but they can also cause widespread inflammation. As the immune system becomes overactive, this inflammation can extend to the brain, disrupting its normal function. In some cases, sepsis can impair the brain's blood flow, leading to confusion or disorientation. For instance, a person may become less aware of their surroundings, have difficulty concentrating, or feel a sense of unease that they can't explain. The mental fog caused by sepsis may also lead to hallucinations or irrational thoughts. This symptom is particularly concerning in elderly individuals or those with pre-existing conditions, as it may be one of the first and most obvious signs of a systemic infection. Prompt recognition of mental status changes can help healthcare professionals identify the onset of sepsis early, which can significantly improve treatment outcomes. Extreme pain or discomfort. Severe, widespread pain can occur due to the body's immune response to infection. Another critical sign of sepsis is extreme pain or discomfort. Unlike localized pain, which might be associated with an injury or a specific infection, the pain from sepsis tends to be widespread. Patients may describe it as the worst pain they have ever experienced. This pain is not confined to one part of the body, but can be felt throughout, reflecting the body's systemic response to infection. Whether it's severe muscle pain, joint discomfort, or a deep ache, the sensation can be overwhelming and exhausting. The source of this widespread pain lies in the body's immune response. When bacteria or other pathogens invade the body, the immune system activates a complex series of reactions. White blood cells and proteins are released to fight the infection, but in the process, they can cause widespread inflammation. This inflammation triggers pain, as the body tries to protect itself from the infection. The body essentially enters a state of hyper-alertness, constantly sending pain signals to the brain as a warning. Unfortunately, this constant alert can leave a person feeling vulnerable and fatigued, making it all the more important to recognize the pain early. Changes in body temperature. A fever or hypothermia, particularly the latter, can signal sepsis and is often linked to severe cases. Changes in body temperature are one of the hallmark signs of sepsis. In most cases, fever is the body's natural defense mechanism to fight off infection. When the body senses an invader, it raises its internal temperature, creating an environment less hospitable to bacteria and other pathogens. However, this fever is not always the case, especially in severe sepsis, where the body might experience hypothermia instead. Hypothermia, or abnormally low body temperature, is particularly concerning. While fever is more common and is a sign the body is working to fight off an infection, hypothermia signals a severe form of sepsis or septic shock. This occurs when the body's ability to regulate its temperature fails, and the body struggles to maintain warmth in response to infection. Hypothermia is a dangerous warning sign and often indicates that sepsis has advanced to a critical stage. Early detection of body temperature changes, particularly a significant drop in temperature, can help healthcare providers quickly identify and manage the infection before it becomes life-threatening. Fast heart rate. An elevated heart rate occurs as the body tries to increase oxygen delivery to vital organs. A rapid heart rate, or tachycardia, is another early warning sign of sepsis. As the infection spreads, the body's metabolism increases, and the demand for oxygen rises. In response, the heart begins to beat faster, working harder to deliver oxygen-rich blood to vital organs like the brain, kidneys, and liver. The body's attempt to maintain oxygen levels in the bloodstream is an automatic, survival-driven response to the stress caused by sepsis. Additionally, sepsis can cause blood vessels to dilate, leading to a drop in blood pressure. To compensate for this, the heart speeds up, trying to maintain blood circulation and prevent organ failure. If the heart rate becomes too fast or irregular, it could be a sign that sepsis is affecting the body's cardiovascular system. It's important to note that tachycardia can be a significant indicator for healthcare providers, especially when combined with other symptoms of infection. Fast breathing rate. Increased respiration helps the body cope with the higher oxygen demand during an infection. As sepsis progresses, the body's oxygen demand increases, and one of the ways it compensates for this is by increasing the breathing rate. A person with sepsis may experience rapid, shallow breaths as their body works to deliver more oxygen to the tissues and expel carbon dioxide more efficiently. This is the body's attempt to keep up with the metabolic changes caused by the infection. In some cases, the body may also develop metabolic acidosis, where the blood becomes too acidic. To counter this, the body may attempt to breathe more rapidly, expelling excess carbon dioxide in an effort to restore balance. Fast breathing is often one of the earliest signs of sepsis and can be observed before other symptoms become noticeable. For healthcare professionals, a rapid breathing rate can be an important indicator that an infection is affecting the body's ability to maintain oxygen and pH balance. Recognizing this sign early is crucial for timely intervention and effective treatment. Fatigue and weakness. These symptoms stem from the body's energy being diverted to fight the infection. Fatigue and weakness are common in the early stages of sepsis. As the body diverts its energy resources to fighting the infection, it can leave a person feeling exhausted. This profound sense of tiredness is more than just feeling sleepy. It can make even simple tasks feel incredibly difficult. People with sepsis often describe a sense of overwhelming weakness that drains their ability to function normally. This fatigue is not just a byproduct of a fever or discomfort, but a direct result of the body's inflammatory response. The release of inflammatory cytokines can affect muscle function and energy levels. As the body focuses all its resources on fighting off the infection, other systems like the muscles and the nervous system may suffer. In addition to physical exhaustion, this mental and physical fatigue can make it harder for a person to seek timely medical help, which is why recognizing these symptoms early is so important for improving outcomes. Skin changes, pale or bluish skin, rashes, or mottling indicate compromised blood circulation and potential sepsis. Changes in the skin's appearance are also key indicators of sepsis. As the body fights infection, blood flow to the skin may decrease, especially if the body is prioritizing blood flow to more vital organs like the heart and brain. This diminished circulation can result in pale or bluish skin, which suggests that the tissues are not getting enough oxygen. In addition to color changes, the skin may develop rashes or a mottled appearance, often described as a marbled look. These skin changes are a warning sign that the body is experiencing circulatory issues, which can worsen as sepsis advances. Rashes and mottling often occur as the body struggles to maintain normal blood flow, and in some cases, they can signal the progression of sepsis to septic shock. Timely recognition of skin changes can be a critical step in preventing severe complications and can help doctors intervene before the condition becomes fatal. Low blood pressure. A drop in blood pressure often leads to septic shock, reducing oxygen delivery to organs. One of the most dangerous signs of sepsis is low blood pressure, which occurs when the infection causes the blood vessels to dilate and become more permeable. As the blood vessels expand, the body's ability to maintain normal blood pressure is compromised, reducing the flow of oxygen and nutrients to vital organs. In severe cases, low blood pressure can lead to septic shock, a life-threatening condition where the body's organs begin to shut down due to inadequate circulation. Early identification of low blood pressure is crucial for preventing the escalation of sepsis into septic shock. If left untreated, low blood pressure can rapidly worsen, causing organ failure and potentially leading to death. Monitoring blood pressure and recognizing the early signs of hypotension can help healthcare providers take immediate action to stabilize the patient and prevent further complications. Diaphoresis, excessive sweating. Sweating can be triggered by the body's stress response to infection. Excessive sweating, or diaphoresis, is another key sign of sepsis. This sweating is often not related to physical activity or external temperature, but rather a response to the internal stress caused by the infection. The body's autonomic nervous system activates in response to the infection, triggering sweat glands as part of the fight or flight response. This increased sweating can be a sign that the body is working overtime to fight off an infection, and it often accompanies other symptoms like fever or low blood pressure. Recognizing diaphoresis can be especially important when it occurs without a clear cause. If a person is sweating excessively without being physically active or in a hot environment, it may indicate that their body is under serious stress. Sweating in sepsis is a protective response, but it also signals that the infection is taking a toll on the body's ability to regulate its internal environment. Decreased urine output. A reduction in urine production reflects potential kidney impairment due to low blood pressure. Finally, a decrease in urine output is a significant early indicator of sepsis. As blood pressure drops, the kidneys receive less blood flow, which can impair their ability to filter waste and produce urine. In an effort to conserve fluid and maintain blood pressure, the kidneys reduce their output of urine. This reduction in urine is often one of the earliest signs that sepsis is affecting organ function. In severe cases, decreased urine output can lead to kidney failure, which can be life-threatening. Monitoring urine output in patients with suspected sepsis is crucial for identifying kidney impairment and preventing further damage. Early detection of this symptom can help prevent the progression of sepsis and improve the chances of a successful recovery. By recognizing these early warning signs of sepsis, individuals can seek immediate medical attention, which can significantly improve the chances of survival and recovery. Understanding and awareness of sepsis symptoms are essential for both healthcare professionals and the general public, as early detection remains the cornerstone of effective treatment. So now, you have a better understanding of the early warning signs of sepsis and why they're so important. As we've seen, early detection and timely intervention can save many lives, preventing severe damage and consequences you might never expect. Your health and the health of your loved ones is the most valuable thing you have. So, don't let small signs go unnoticed, as they could turn into a serious threat. We hope this video has equipped you with the knowledge to effectively identify and address sepsis. If you found this video helpful, don't forget to like, share, and subscribe to the Heal for Horizon channel for more valuable health information and updates on new videos. We are here to provide you with essential healthcare insights, and you are the reason we continue to create these valuable videos. Thank you for watching. Always pay attention to your health, and remember, a little attention can save a life. Wishing you good health, and see you in the next video.